Well, hello and welcome to Rajat TV. You're watching India Fights Back with your host, RAJAT, KAIN. Well, if you've recovered from COVID or just recovered from COVID, have you started to forget things? Are you experiencing something unusual in terms of remembrance? Are you having headache or feeling of nausea? Or possibly you're just slipping into a zone where don't you remember things that just happened a while ago? These are common symptoms that have been found among patients who have just recovered from COVID, especially post the second wave, and of course, which was extremely torrential, extremely catastrophic, with number of lives lost and people struggling to get medication and oxygen in particular. Now, experts, medicinal experts are looking at the post-COVID recovery symptoms. Among several of them, there have been some instances of acute post-COVID symptoms. Among those things, one is brain fogging. Now, how important is it to pay attention to these small details if you've just recovered or are still recovering from COVID? Remember, a lot of experts in the field of medical sciences have termed illness as long COVID as well in some cases, not every case, but in few cases. Now, how important is it to look after yourself and look after these small little symptoms, which is essential to be reported or at least consulted with the experts? Now, to discuss further on this issue, we join with panel of two guests, Dr. M.V. Padma Srivastava. She is Professor and Head of Department Neurology, AIIMS, and Chief of Neurosciences Center. Many thanks, Dr. Padma, for joining us, and Dr. Jyoti Kapoor. She is Senior Psychiatrist from Paras Hospital. Many thanks, Dr. Kapoor, for joining us. Let me start with you, Dr. Padma. Ma'am, how important is it to pay attention to small symptoms of brain fogging, or to say at least something to do with neurology per se?
Yes, a very pertinent question, I must say. See, the thing is that we've recognized over a period of time, ever since this pandemic struck, that beyond the ILI and SARI, that is the influenza-like illness, the respiratory features, that COVID is a systemic disease and various organs are affected, and most so the nervous system. So we've actually seen patients presenting with brain attacks or strokes, even without any respiratory features in acute COVID. So when you're talking about long COVID or the post-COVID survivors and their problems henceforth, we can have the acute situations as well, which are in terms of acute strokes or brain attacks, various clots which keep happening in arteries and veins. We can have various varieties of paralysis, right? But this specific thing that you're talking about as the mental fog or brain fog is a loosely coined term, which actually describes a situation where there is a sort of a pervasive confusion and a lack of clarity and some dysfunction in the executive aspects. And, especially when they do multitasking, the same kind of alertity and the same kind of clarity with which they used to perform before is not there. So it is loosely termed as a mental fog, which also has this kind of a recent memory issues. Said that though, more commonly what we see is persistent headaches or dizziness or general fatigue kind of features, which may last for 3 months, 4 months, 5 months. And, Rajatji, you're aware of those complaints like lack of smell and lack of taste, which in nausea, which also, in fact, are part and parcel of the panel of the spectrum of presenting features, and they are also supposed to last for almost 12 months or so. That was the last publication. Said that, I must say that beyond this also there's a lot of research which is going on in terms of how this long COVID, because of its neurotropism, because of various other issues which have been hypothesized, so whether they would lead to a long-term neuropsychiatric or even degenerative issues, which includes PD and Alzheimer's, and there's a multinational 190 countries involved research which is presently ongoing. So yes, there seems to be literally this kind of a tail of issues which
Right.
which have been recognized, which have been published. In fact, a lot of data which is already published on this aspect. And recently, we've also had some MR studies which have shown some brain shrinkage in certain areas in these people who have survived COVID. So yes, there is a lot of issues which are emerging, and we'll talk about how to be able to deal with it and how to probably, try and prevent these things.
Certainly.
If the time permits, we can talk about that too. Yes,
Absolutely.
there's a long spectrum which is seen.
Absolutely. Many thanks. Dr. Padma, just stay on. Many thanks for your opening remarks. Certainly, we'll try and explore this issue threadbare as it sort of affects everyone, especially those who have recovered, who have survived the second wave of COVID pandemic. Dr. Jyoti Kapoor, ma'am, post these 2 months, like April and May, where we saw a large number of cases, which vastly affected large number of people in our country. Are we seeing more and more people looking out for psychiatric help?
You're right, Rajat. And in fact, in our experience, we have seen that over the past 2 years, the amount of stress that was generated because of the pandemic, it has resulted in vulnerable individuals to develop depression, anxiety, clinical symptoms of obsessive compulsive disorder. But having said that, the psychiatric issues, psychosomatic issues, or psychological issues always tend to coexist when there is a serious chronic or acute condition. So COVID has manifested as an acute condition, and because of its impact and its repetitive waves that have been coming in, its consequences have been chronic from the psychosocial perspective, and that has resulted in immense amount of stress from the disease itself and its severity to its impact on people's lifestyles, because they have to stay indoors and they have to work from home. A very new culture has been beginning. The loss of social interaction, which is very important in human health. The loss of financial certainty for many people, the uncertainty associated with the economic condition of the country. All of these factors have created an immense amount of stress, and stress itself is one of the factors which triggers many psychiatric illness. In our OPDs, we have been seeing a surge of patients coming with anxiety disorders, and almost 70% of people who are coming with anxiety do mention, COVID as one of the triggers because of which their thoughts have become more and more negative, and they have not been able to sleep well, eat well, feel happy, go out, be relaxed. So COVID has been one of the major factors.
Right. Dr. Kapoor, before I move to Dr. Padma to just open discussion and take it a little more in a concentrated way, just I want to emphasize on one thing. Is there a particular age group that you have seen, the ones who reported a stress disorder or anxiety disorder, as just mentioned? Is it confined to a particular strata or an age group, or is across the board we're seeing these symptoms, to say off?
No, I wouldn't think so. There is a particular age group, but yes, the people who present to us more often have been the geriatric population, primarily because they were the worst affected in the first wave and also in the second wave. So their anxieties have been immense, and that is why they have developed a lot of symptoms. And some of these symptoms, like Dr. Padma also mentioned, are very physical symptoms. So insomnia is one, and confusion is another. In fact, post-COVID or during COVID, development of delirium and encephalopathy is one thing that we have noticed very often during this period in our hospitals. So geriatric population is one which has been largely been brought up, but the middle age group, 20s to 40-year-old age group, has suffered from anxiety. Children and have not been presented very often, but we are hearing complaints right, left, center, especially the psychologists and pediatricians, because children are developing a lot of behavioral issues and anxiety issues because of this. So I would say the effect is rampant, and it's across the age groups.
Right, right, certainly. Thanks, ma'am. I'll just stay on. I'll come back to you. Dr. Padma, as we just discussing about COVID and post-COVID recovery, so what explains the length or to say of the period of recovery? We have we already grappling with the long COVID issues. There have been people who are still struggling with the smell, with sense of taste. So how long does these symptoms often persist?
So it's now been, there's been recent literature on that, and it's been published that the smell may recover on its own, and it takes about 10 to 11 to 12 months. So we may need to wait that long for these issues to recover, which is a good thing in the fact that it is recovering, but it may take a little longer. It's not going to be permanent. Said that, the other issues, like for example, say headaches, those who have had migraines, they have this chronic daily headaches, which are not exactly migraines, but they are there. A lot of them post-COVID, they present. And in these situations, we do get a neuroimaging such as an MR done to rule out a venous sinus thrombosis, because sometimes you have these blood clots forming in the veins. So one structural imaging we generally do to rule out issues, but largely they are normal. And they have this chronic headaches which subside with time. So we reassure them, tell them we do the test, partly because we have to rule out other causes which cause this headache. And once they are ruled out, they generally do very well on counseling and they come out of it. The other is this chronic feeling of dizziness, something kind of an imbalance.
Right.
Along with which there is a generalized fatigue. These also we've seen lasting about 4 months, 5 months, and they come out of it. So largely these things are self-limiting. They probably don't need anything much except some supplements, counseling, mostly reassurance than a bunch of medications per se. And in summer months we say avoid dehydration, take good amount of, so don't get into severe physical exercise. And the other thing I want to point out, Rajaji, is don't get into very severe physical exercise immediately after a COVID recovery, especially those who've had some biochemical markers, certain things which point towards a clotting problem or a cardiac issue. We tell them don't get into a very severe physical exercise program immediately after COVID recovery. So some do's and don'ts, and they do well. But the other thing, say for example, a brain attack or a stroke, they are largely to be prevented, because once they happen, then they take its, the usual course that a stroke would have. And a lot of varieties of paralysis that we have seen, say for example, we've seen Guillain-Barré. Right. That's a kind of an acute to subacute over a period of couple of days. They develop this paralysis of the whole body because of involvement of nerves. And they also seem to do pretty well. When they're picked up early in the institute management, they also recover a period of 2 weeks to 3 weeks. And there are certain focal paralysis, say example, a facial palsy, there's a deviation of the face. They also do well. So largely we see that a lot of acute conditions seem to do well, but the important thing is to pick them up early and institute the usual management. And the other symptoms like headache, dizziness, are largely just conservative and they disappear on their own. Smell and other issues may take about a year to recover. And other things, as I said, degenerative diseases, we don't know. The research is still on.
Right.
We need to find out over a period of time, whether they develop and what happens, to that group of patients.
Certainly, certainly. Well, dear viewers, you're watching the show, listen to the experts. Listen carefully as to what they're saying. Do not listen to any hearsay or misinformation. As we have seen, especially during the pandemic phase or even during the entire COVID period starting last year, there has been a lot of misinformation that we often come across. So do not go for any misinformation. Do not fall for any misinformation. Keep listening to experts. Keep taking their advice. That's a way forward if you're recovering from COVID or if you are safeguarding yourself from COVID. Dr. Kapoor, just building on to your reply to my last query, we ended on the effects of the long COVID or the symptoms or neurological disorders on the adult. Now, how is the children population or juvenile population is faring with that? I mean, they've been confined to homes. A lot of them, they're not heading out, they're not meeting their friends or teachers, they're not going to school, and some of them possibly have seen their elder lot suffering with COVID. So, how has this long COVID, or at least say COVID recovery, has affected them, children?
I'm glad you picked up this question because I've been saying for a while that probably children are the most ignored during this pandemic. We were worrying about everybody who was, catching the infection, and children were not. But then children were bearing the brunt of it. See, as a spirit, children are free-spirited individuals. They are growing personalities. They have to interact with their environment and their social structure to be able to develop a balanced personality. What COVID has done is that it has made us all withdrawn and scared. And this kind of scare or fear, when it happens, it causes our nervous system to go into a defense mode. We are in a hyperarousal state. And this hyperarousal state basically means that you would have telltale signs of stress. Children react more to the stresses around them because they are still an immature nervous system. They still haven't developed coping mechanisms to deal with changes, especially sudden changes. So this has caused a number of problems, starting from issues of concentration, anxiety, difficulty in sleeping. Some of the vulnerable people have actually developed obsessive compulsive disorder. I have seen a number of children in the age group of 13 to 14 years of age group who have developed OCD for the first time after the onset of COVID-19 with no prior history and no family history also. Other than these clinical syndromes, you will see a lot of behavioral changes that children are having. So irritability is one of them. Indisciplined routine has affected the sleep-wake cycle, which has caused a lot of lifestyle-related issues. Physical health is suffering because there is less physical activity and a lot of, sitting in front of the computer and being on the screen, which has telltale signs on physical health. Our pediatricians have noticed increase in weight, obesity, and some similar symptoms, especially musculoskeletal symptoms, headaches, neck pains, back pains in children. Psychologically speaking, confined to a limited space where parents are also working, children are also working, and probably the elders in the house, it causes a very, limited, restricted environment that can become stressful in its own self, because we need our personal space, and personal space is a mental boundary that we have around us, our bodies, and that gets affected. Now, when you have to, focus on your studies, and you may not have all the gadgets, so, you need a laptop to be able to study, but you may be working on a mobile. All these things have created a lot of stresses among children, and unfortunately, because everybody has been dealing with their own troubles, people getting sick, these symptoms may have been ignored. The other important aspect is loss. Loss because of COVID. Many children have suddenly lost, some of them even both parents, within a span of, within an interval of 1 week. Children have lost their grandparents. And we are hearing so much negative news around us. So all of that has definitely put them on the hyper-alert space, which can have long-term consequences on their developing personality. So we need to tackle the psychiatric effect on children at this point of time, because these children are the future. They are the ones who are going to, become the next society, the post-COVID society.
Right. Just stay on, Dr. Jyoti. I'll just come back to you. Dr. Padma, as we were discussing about symptoms and how they've come forth, especially after the second wave. I'm just reading out a couple of stats from the Lancet study. 34% of COVID-19 patients examined have been diagnosed with neurological or mental health disorder in last 6 months, 6 months after infection. And for 13%, it's for the first time that they've been ever diagnosed with any mental disorder, or to say at least a psychiatric diagnosis. Now, how do we say address these issues? How do we go for if one may call it a cure, or at least getting coming out of it in a better sense?
See, Rajat, the first thing we need to do is, of course, become aware of it, that yes, this is happening. Like Dr. Padma also mentioned, that many of the people haven't even got pulmonary symptoms and they have got neurological symptoms. Now, sometimes we think that we don't have a problem because we are scared of, the stigma or the label associated with it. So, going to a psychiatrist or for psychological issues becomes something that people don't really want to do, especially when it comes to younger population or children. They don't want to take them to a psychiatrist. So it's very important to first and foremost be aware that such problems are real and they have long-lasting impact, not only on the psychological health of a person, but also on the physical health of the person. Because when you're stressed, when your psyche is unstable, it affects the whole body. Your hormones are disturbed, your neurotransmitters are going haywire, your musculoskeletal system is under stress. So it causes a lot of psychosomatic symptoms, which are the grounds on which major physical disorders like, hypertension, diabetes, PCOS, hormonal dysfunctions develop. So we have to be aware. Right. Second thing is to screen and identify. So I have asked even our hospital to start a post-COVID clinic, and many of the hospitals, I'm sure AIIMS has a similar setup also. The post-COVID clinic needs to have a psychiatric screening mechanism as well. It's a simple scale we need to assess the level of anxiety and stresses in an individual, and they can then be referred, if their cutoffs are high, they can be referred to the psychological or psychiatric interventions, and then the problem can be taken from there. So first thing is awareness, second is identification and screening, and then the third point is intervention. And when we are doing intervention, we have to make it part of an overall treatment. So, just saying that it is happening just because I had COVID. Well, the point is not that just because you had COVID, the point is that you have it. And if you have it, it needs to be treated. We can't keep saying कि COVID की वजह से है. तो वजह से तो होगा, पर ठीक तो उसको करना ही है. So I think these are the three logical steps that we can follow. The other things like Dr. Padma mentioned again.
Let me have Dr. Padma here. Sure. Dr. Jyoti, let me just have Dr. Padma here as I'm just about to, I'm heading towards the close of the show. Dr. Padma, your last word, ma'am. Go ahead, ma'am, please.
Right. So, as I said before, COVID or no COVID, we need to learn to now deal with it. We've had enough experience now with 2 waves. So the first thing is to prevent that. Even if the third wave is supposedly to come, we can, it's in our hands to make it into a ripple and not a big wave. So that's the first thing. The second thing is, don't be scared. We can deal with it. Now we have the experience to how to manage it. So one is the prevention. So do get vaccinated so that even if the COVID happens, it remains a mild disease. And even in the post-COVID, I guess, as Dr. Kapoor said, mental health is an absolutely mandatory issue, which probably involves the entire spectrum of living there. And as far as structural damages are concerned, we should be aware that these can happen and again prevent, detect it, and when it's treated early, you can definitely live a long and normal, healthy life. Don't be afraid.
It's a catchword, ma'am. You said treatment early. Just like, I just want to squeeze in one small question to both of you. When we call for treatment, is there a still stigma attached to any psychiatric help that we seek out? Are people are open to come out and accept, or at least confide? Okay, boss, हमारे साथ ये problem हो रही है. We're going through this. Is it still happening, or still we are undergoing a stigma? कि नहीं, let's keep it to ourselves. Dr. Padma. Okay.
No, I think if I have Dr. Kapoor there, if I have an issue, I will go to her. You should not hide that. Go for help. Early help will definitely get you out of it. There should not be any stigma, but reality is that we still have a long way to go. Dr. Kapoor, please.
Yeah, please, ma'am.
Yeah, Dr. Padma, you're right there, and Rajat, you're right again about labels that we talk about. So, yes, in urban populations, still people are coming out and talking about their issues. So because I'm based in Gurgaon, I see a lot of people coming. But I do know that in suburbs and in rural populations, still the acceptance is low. But if our own medical faculty is open to the idea and they guide people, people listen to the doctor. And especially in the suburban and rural area. So when a patient is referred, say, by a neurologist or by a pulmonologist that, your breathlessness could be related to your anxiety, please go visit a psychiatrist. Many of them are willing to come. So programs like what you're doing right now, awareness that we are spreading in the community, and there are a lot of programs there, and doctor faculty who is guiding patients to the, for treatment in the right areas of intervention, all of that is definitely helpful. I do see that it is going to get better. And one last word, although we are short of time, I think COVID has put a major focus on the mental health issue. Many people have talked about it because it has directly affected a huge number of population, especially the doctors, police force, and the journalists. These are the three in research which have been noticed who have come face to face with so much morbidity and mortality and have felt so much helplessness and hopelessness in that field that they have understood that, it is something that needs to be dealt with, and people around have been accordingly guided. So I think we are, if we take heed into the lessons that we have learned during this COVID pandemic, we would become more better.
Right, right. Well, so we sign off on this note. Many thanks, Dr. Padma Srivastava, and many thanks, Dr. Jyoti Kapoor, for discussing threadbare this extremely important issue. Well, call it brain fog, or call it neurological disorder, or accept a problem that post-COVID, or not really post-COVID, there are some problems concerning us in terms of anxiety, and that needs to be addressed. So please go forward and seek counsel, medical counsel, expert counsel as and when required. Well, that's it in this edition of India Fights Back. Stay tuned for more on Rajya TV. Thank you and goodbye.